we're talking health and we're focusing on front of pack nutritional or warning labels. There are different dimensions to them and which our Food and Drugs Authority ought to feed in. Well, joining us in the studio, we have Professor Kingsley Asare-Preko. He is an associate professor and senior member, Department of Community Medicine and Vice Dean School of Medical Sciences, and also an immediate past president of the GAND. We also have in the studio Pearl Ehwanam Salome, who is PRO of the GAND. A very good morning to you.
Good morning.
It's good to have you join the conversation. Let me start with you, Prof, very quickly. How important is it to have this conversation on labeling on food? Recently, someone showed me a product, and I didn't realize it, but they had stuck a whole new label on it. The same thing, but because the expiry date had changed, it was an expired product. They had put a whole new label on it, covering the original label.
Right.
Why is it important that we take a look at some of these things?
Well, it's really, really very important. I would start from the statement that always comes up when we talk about nutrition, that you are what you eat.
Right.
And I simply say that if we are what we eat, then we should be mindful of what we take into our bodies. Importantly, when it comes to processed or packaged foods, you are not in the kitchen where it was cooked. And there are many things that comes within these food that have been packaged or processed that might be detrimental to your health. For example, if you are diabetic, for example, and you are picking on foods that are having high sugar content and all that, you may never know unless something is placed behind the pack of whatever you are consuming that tells you what is in it for you. Then you can be a bit cautious about what you have to take. Importantly, like you indicated earlier, that, when the expiry is hidden, when foods expire, it comes with all sorts of issues, which might not be in good taste for your health and well-being. So as part of we being concerned about what we take into our bodies, since our body is just made up of what we eat, it is important to know what is going into your body. And package, front of pack labels gives us more of a direction as to what is going into us and gives us an idea about what we should do as far as these foods are concerned.
Okay, so Paul, let's talk about the importance of this push now, this campaign for front of pack labeling. Why is it so important today?
Thank you very much. Having the labels and this campaign is very important because currently we are dealing with a disease burden. When you look at the data, the number of Ghanaians that are getting the NCDs, talk about diabetes, type 2 diabetes, hypertension, and the heart diseases keep rising.
Cardiac issues.
Yes, and it is linked to dietary practices, what kind of food choices people are making. So we believe that it's timely that these labels are made mandatory so that when somebody is making a choice of food or snack, whatever, they know what they are going in for. And we believe also that it will help reduce the disease burden in the country. Because countries that have been able to do this are seeing reduction in this regard.
Right. How does this work to protect consumers? How exactly will it work to protect consumers?
It would protect consumers because, like Prof said earlier on, if you walked into a grocery shop and you wanted to make a choice of snack or a food package, because you know what is in there, you will make a better choice.
An informed choice.
An informed choice. If it's blank and you don't really know what you are taking in, it makes it really difficult to know what you are going in for. So in a way, it's going to help the consumer make better or healthier choices.
And Prof, we are not alone in this. About 40 countries have different legal instruments on some of these developments. And topical among them, you have the US, which has now decided to have certain stringent measures. Right. Companies producing, these products with 10 million plus in revenue. In 3 years, they must get things done. Right. Others below that, in 4 years, they must get it done. Right. And what Pearl said about the health burden, it reflects in their country. How does it reflect in Ghana And why should we, pay attention to it?
Well, I think that I'm sure you glance the news more than I do. But, I mean, from the research evidence that we are having a rising burden of non-communicable diseases in the country. And this is also really, really a very pressing issue for Ghana. As we are battling undernutrition, issues of overnutrition is also plaguing us. And recent GDHS report places around 50s for adults, overnutrition and obesity. Children are also not spared in all these processes. And we know that the after effects of these issues are the non-communicable diseases and the varied metabolic syndromes that we have within our space. So within Ghana, we are having a serious issue as far as NCDs are concerned. And importantly, as we transit, we are having a bit of transition in our diet. We are leaving the normal cooked foods that we have within our homes to eating much from the streets and eating much of processed diets, which have key implications on our health. And this makes it very, very relevant for us that we do this to save the situation. Of course, the other aspect also is the cost of care. When you look at the issue of NCDs, it's really, really high. I mean, take a basic thing like kidney disease. I mean, to go on dialysis is not a joke. And even for basic cardiovascular disease issues, when you go to the hospital now, the test results, they're just doing the test alone is of a very high cost. And so it's something that we should strongly do in this space of time to save the situation.
And speaking of that cost, if, again, the American example, because sometimes we don't have this data here, how much we are spending, about what? Almost $5 trillion going into dealing with these cardiac issues, obesity, diabetes, and all of them.
All that.
The cancers,
yes.
You see. And let's not forget that it would impact you, medical insurance, debt for some people, and even work, the labor force. But what then is the solution? What can be done? Let me come to Prof on that before I come to Pearl.
Well, quite a number of things have to be done in this. Importantly, improving the information base of the public, creating awareness within the public. But there are things we call upstream and downstream factors, things that you have control of and other things that you don't have control of, like the space. The media space is full of advertisements that is enticing you every day.
Right.
When you go to the market, things that are cheaper are the processed ones and not the raw food. So policies that address the marketing of foods, policies that addresses improving agriculture and all that are important. But one of the most important public health policies that have really helped is also front of pack warning labeling that helps guide consumer choices of what to eat and how to eat healthily. It's one of the main front of pack warning label has been one of the most effective policies, and that is why probably we are much more into this. But it goes with many other policies, improving agriculture, improving our food systems, having policies that mandates certain regulations to be respected. Importantly, when it comes to marketing restrictions and all that of these foods that are harmful to us.
Paul, we know that talking dietetics, you would know, the more processed a certain food is, the more likely it is to give you all of these things, more saturated fats and all that. How crucial is policy then in shaping all of this? What can we do from where we are?
Well, in terms of policy, like Prof already said, we need a lot of support from government to make sure that these policies are implemented.
Okay.
Because if they are in place, we can run with it. The various stakeholders, the various agencies that are supposed to make sure that these policies are working will come on board, and then we'll see the change that we are seeking to see. At the end of the day, we want to see healthier populations. We want to see healthier workforces. We want to see the disease burden of the country going down. And so, yeah, that is why we need these policies implemented.
Do we have, as a country, do we have any policies in place yet? Are there any steps we've started taking? What would be your call? I'll come to you, Prof, on that as well. But what would be your call to, policymakers, regulators, even government on this?
Our call to government and the policymakers will be that we already have conversations already ongoing, work already that is being done.
Okay.
Yeah, in this regard, but we would humbly plead that things are sped up so that the policy is implemented.
Prof, before we get to the bit about more public involvement and all of that, on the bit about policy and where we've come so far, is there anything you'd like to add?
Well, I would just add that, yes, within the country we have policies that guide food, which the FDA is implementing. Of course, we have labeling
which are
policies.
sometimes flouted.
Of course, because there are always spaces within it that allows the industry or others to forgo. But again, when it comes to the aspect of food labeling, there are policies that guide that at least when you pick any food in Ghana, there are some basic information you should have, country of origin, expiry date, and those information. These are all within our policies. But it comes with its own shortcoming. Within the country, also other policies are being pushed because they can also help improve the food environment. And part of it has been the fiscal policies like the SSB issues. Part of it has been market restriction policies, food procurement policies for government institutions and all that are being developed. And importantly also the front of pack warning label is under various stages of its development within the space of Ghana, of course. And I'm sure within time it may come up.
Growing up, whenever we sang that song, "Arise, Ghana Youth for Your Country," we would get to the point where we would say, we are all involved.
Exactly.
How involved should we be as ordinary citizens in pushing this, especially as parents who will buy these things for children, as the children and others who will consume them? How concerned should we be?
I think from the parents' side, we should be. Because currently we see that it's the children that are telling us what to do.
I want this.
I want this. And you can't deny your child. So we should be very involved in helping push for policies that would restrict the space within which some of these foods that impact on our health are advertised. We also have to be involved as far as we are as a community, because when you get sick, the family budget is hugely affected. Our health, the cost of health on our family budget is high. And some diseases would really, really drain the family of its coffers. So this should push us to demand government as the same as we demand for road, the same as we demand for hospitals. I think what we should focus our attention on is demanding for things that would prevent us from going to the hospital in the first place.
Okay.
And
now, looking at all of this information you've given us, before I take your final words, Pearl, where can people go to join this campaign? I mean, social media, website, where can people go?
Yeah, so on social media, we've done a number of campaigns. Okay. So you go to the GAN website. And
that is GAND website.
Yeah, and then also the social media handles, a number of campaigns.
Can you give the full rendition so that people can know where exactly to go to? And while she gets that ready, Prof, what will be your final message for us? Action, what should we be doing? And what are the key details of tomorrow's launch?
Right, okay, good. The key details of tomorrow's launch is we trying to advocate for a mandatory front of pack warning label policy, as that has been one that has been very significant in impacting public health outcomes. And we would expect that Ghana brace itself to embrace it just as any other countries are embracing to control and improve their food environment.
Okay. That will be the message. Pearl, are you ready for us now?
Yeah, so on Facebook we have the Ghana Academy for Nutrition and Dietetics. Yes, and then...
So the Ghana Academy of Nutritionists or Nutrition and Dietetics.
And Dietetics.
Okay.
Yes. And then on Instagram, we are officialGand_.
OfficialGand_. And what we are talking about is kind of like now when you pick a cigarette pack, you see how boldly it is there. Smoking kills and all of that with lungs, and back then it wasn't like that. That is the kind of arrangement we are talking about. But this time for all food and other products, where you would see clearly the levels of saturated fats, sugars, added sugars, and all of that. So you see what you are buying. And if you are buying it cheaper, you know that it may be cheap, but this could be the cost to your health. I'd like to say a very big thank you to you. Maybe if you have some 15 seconds, any final words, then we go.
Well, my final words to Ghanaians is that, like Prof said, you are what you eat. And you have the power to make a choice that would fuel disease in you or heal you.
Right.
So always keep that in mind when you are making your food choices.
You are what you eat. Prof?
Yeah.
Right. So nutrition is the bane of development. And if we fail to improve our nutrition in Ghana, we will entirely fail the nation.
Right. Thank you so much. Where is the launch happening?
It's going to be at the College of Physician and Assistants.
Okay, so the College of Physicians and Assistants, you say?
Yes.
All right. Thank you so much. And those who joined us for the conversation, Professor Kingsley Asare Preko, he's an associate professor. He's also a senior member, Department of Community Medicine, and Vice Dean of the School of Medical Sciences, and an immediate past president of the Ghana Association of Nutrition and Dietetics. We also had from that association, the PRO, Pearl Ehonam Selome. On that note, we take a breather. Don't you forget, the AM show is proudly sponsored by Waylead Properties. They provide quality housing at an affordable cost and with a flexible payment option. We'll be right back after this break.